Thank you for coming. Yes, I'm a physician. I'm a pediatrician, preventive medicine doctor. I have my master's in public health. And speaking of that, I'm like convinced I love this space a whole lot, but this is where all the mosquitoes in New York City come from, you know? Yeah. Just kidding. But anyway, yes, so I went to Hopkins, and whenever I got done, I really didn't know what I was going to do with myself. So I did. I started this sort of practice where you could just go to my website, see what I was all about, see my story, click on make an appointment. It would bring up my Google Calendar. You could tell me your symptoms and your address, and hit submit, which would alert my iPhone. And I would go do a house call, and you'd pay me via PayPal. So that was sort of like my sort of claim to fame. It became Hello Health, which was sort of like that plus a platform. So if you can imagine like a secure Facebook to power healthcare, that's sort of what I've been building for the past 2 years. But about 5 months ago, I left and started this company called The Future Well. And that is, if you can imagine, just a design firm for all things health and happiness. We sort of are just getting started. There's 2 other guys with me, and interesting stuff is happening. But I'm not going to talk so much about that. Sorry. Yeah, there we go. So anyway, I'm going to talk to you a little about, I think that there's a real connection in healthcare between quality and design. Because if you want quality, which is like safe, healthcare, right? It's sort of, a good experience as well. You must look for design. And so I'm going to talk to you a little about what I think designing health looks like, especially from the perspective of service design. So I don't know if you guys know, how many people know that like 100,000 people a year die from medical errors in the United States? It's sort of been getting some traction lately. That's sort of like every day a plane full of 275 people going down. This is from one of the crashes that happened in Brooklyn in like 1960 of a United plane. But if you can imagine each can as like, one person, you sort of zoom in and out. And that's sort of like how many people in America die from doctors screwing up. So healthcare is sort of disheveled. I'm sorry about the fear factor, but at the same time, it's sort of like a real issue. It's, the healthcare system is about 2.5 times as deadly as our highway system. And when we have to do the math regarding how many people we save versus how many people we kill, it gets pretty, confusing to me as a physician. So my argument is that basically like healthcare is undesigned. It's really just a pain in the butt. It's pretty ugly. And, you look at a lot of these veterinarian hospitals in the area, and they're designed better than human hospitals. So to me, design is really about designing elegant processes that really don't have like unnecessary steps. They eliminate the potential for error at all steps, and they pretty much delight me every step with visuals, comfort, communication, and just easy stuff to do. So it's sort of like Walt Disney's little process of creativity and organizational structure. It was a beautiful, well-designed, production house. So how can we design healthcare? Well, let's go through the steps of healthcare and think about how we as designers can contribute what we do to saving lives, and actually make the experience of healthcare much more pleasant. So I'm sort of asking you guys, whatever design you guys do, just try to apply it to healthcare and think of ways you can contribute. So right now I'm just going to tell you a little story about, how you go from sickness to getting services and wellness. So here's a little story. We've all been here before. It's Friday. It's 10 p.m. You feel like shit. Your belly pain has been going on for about a month. Now it's really, really, really bothering you. You're scared, and it may be something serious, right? You have no idea. So what do you do? Well, a lot of people go to the internet and Google, and Dr. Google is there for you 24/7, which is nice. But a lot of people don't have, doctor friends or nurse friends. So what do you do? How do you solve it? So what's the process? What do I do, and when do I do it? So today, you pretty much have no clue. Nobody to turn to except for Google, or maybe a nurse friend or something like that. But one of the first things that we're building at the Future Well is a little service that lets you, you tell it your symptoms, if you meet the criteria for an emergency room visit, or if you should just hang tight, or if you should see someone in 72 hours or something like that. This little tool is going to tell you what to do. It's not going to diagnose you or anything like that. It's just going to say, you know what, this isn't an emergency. Don't waste your money on the ER and your time. So it's that simple. And this isn't designed, so that's not, yeah. It's going to look prettier. So basically, it's also going to tell you who you need. So today you have no clue, and nobody to turn to, again. So in this situation, you know, the thing that we're designing, it's basically a web app that knows you, your health status, and your health history. And it's going to say, you know what, here's a list of like 4 gastroenterologists. It's not a list of 900 like you get today. Here's 4 awesome ones in New York City. This is how much they cost. And click here to make an appointment. So for now, this one says, well, you should see a gastroenterologist in the next 3 days. So now, who's best for me? You know, right now you just get this long list of names. You have no idea if your personality jives with Dr. Blewett's personality, which was a pediatric surgeon I used to work with. Nobody got that. Dr. Blewett, surgeon? All right. Sorry. So anyway, I'd love to see something like OkCupid for doctors and patients so that you can sort of, you know, find out who's best for you. What are some personality traits that are awesome for you? How are you gonna sort of jive with this physician? So finding the right doctor is sort of like finding the right spouse, right? I mean, you don't have as much of a commitment, of course, but at the same time, it's like, you know, that's what makes you feel better, is whenever you have a doctor that really speaks to you and with you. So that's sort of, you know, one thing that I think could be designed. Now who's available, right? So today, you go to Google and search for a gastroenterologist. Google returns about 900 results. You have to wait until their office opens on Monday to give them a call, and you can make an appointment in 4 weeks. So one thing I'm calling for, I'm speaking at Government 2.0 next week in DC, and I'd like to see an open source doctor profile format, and as well as that, an open source time format, so that you can essentially go and just do a search just like you're searching for kayak, you know, a trip. And then have an API so that people can create, you know, applications that basically find you what you need. So, I mean, you can see on a map who's available. And then how do you schedule? Well, right now it's the painful telephone circus that we all plague. In Massachusetts, when they mandated insurance in 2007, there's about a 52-day wait to see physicians now. So how can we sort of refine that process? Well, you know, today it's miserable, but if you were sort of designing a system from the ground up, it would be just like renting a zip car, right? So what kind of car do you want? Where do you want it? What time would you like it? And pretty much all on a map for your viewing pleasure, right? So what can you expect? Well, today, what's going to happen at the visit? Well, you don't really know, right? All you know is that your belly hurts and you want it to feel better, right? So designed, in a design situation, right? Based on your description of the problem, 90% of the time gastroenterologists will probably need to scope you, right? So here's some instructions so this can be an all-in-one visit, right? So don't eat after 5 p.m. I like that. And don't worry, we've alerted the gastroenterologist that your coming in time should be allotted to scope you, right? It's because basically what we're trying to do is match up need with supply. So then how do I share my records? So once you sort of, you know, make the appointment and get to the doctor's office, how do you share your records with them? Well, right now, like, you know, it's a paper trail, right? They have to sort of fax you your records. It's sort of a pain in the ass. Or, you know, I'm not even going to explain what I just said. But anyway, that's pretty much my point. The only thing, but what's interesting is the only thing that's connecting the healthcare system and all these resources in the healthcare system is you. So therefore, it pretty much only makes sense that you're in charge of your own records and you must grant access to your doctors, right? So you should be able to say, like, I'm going to add this doctor to my, you know, privacy list, like Facebook has done such a great job at that. So how can you sort of, design a system where it's an open source web-based platform with privacy under your control? And say, it's literally as simple as an iPhone app where it's like Dr. Blewett wants access. Click here to say yes or no. And then you could also click to see their doctor's profile. So what's the visit experience like? Like once you get there, what does it look like? Today it's pretty much pain, suffering, and waiting for 4 hours next to some sick person, right? So, I mean, wouldn't it be awesome if they're running late and they just sent you a little message? Or like, how do I let them know you're here? Do I check in with my iPhone, just like checking in at Foursquare? What does it look like? Is it beautiful? How does the staff greet me? Sort of what's this customer experience map? Just like Starbucks has sort of outlined, when the customer walks in the door, what is their experience? Does healthcare do this for you? Is healthcare sort of optimizing each touch point? And how do you move through the space? Do you sort of snake through all these corridors and see 5 different, hang out in 5 different rooms? Or do you go to one and people come to you? So, healthcare has never been really designed like this from the ground up for this experience. And then how do doctors today learn about you? Well, today it's that paper chart again, right? And sometimes it has a lot of your records, sometimes most of the time not. And sometimes doctors take what's called a social history, which is like, do you smoke? And that's about it. So in the future, though, it would be really great to have sort of, an infographic as well as like Nicholas designs his sort of annual reports, but maybe an interactive one so that, you've given your doctor access and now he or she can sort of click on this stuff to dive deeper into your, your data. And also, it'd be great to be able to like just connect Foursquare and maybe Daily Burn and this thing called Sleep Cycle that sort of monitors your sleep via your iPhone app. Wouldn't it be great to just, connect those profiles to your profile so your doctor can see how well you're sleeping and how well you're eating and, whether or not you're hanging out at the bar every night. Or 4 bars, and then you unlock that, the Binder badge, right? But anyway, so how do doctors really communicate this plan, right? Well, to you after they're done seeing you and all that exciting stuff. Well, right now it's verbal. They just say like you should do this and that and this and that, and then you go home and you forget 85% of what the doctor says, and there's research to back that up. So it'd be great to just have your plan accessible from anywhere you are, right? And saying this is what you need to do, and this is why you need to do it, because a lot of people don't really do something that their doctor says because they don't really understand the need or the importance, or it's just a pain in the butt. Wouldn't it be interesting if doctors knew who you are and made a plan that like really conformed to like your life? And then the other thing is like, how do docs ensure safety? Today we sort of hope and pray for the best, right? In the future, well, I mean, these checklists have actually been shown to markedly save lives in healthcare. So my recommendation to you guys is if you're ever in need of something done in a hospital, do the research to see if they use checklists. If not, just find another hospital. Because it's like going to a really deadly, road in like middle of nowhere in the world. And it's weird for me to say that because, I worked in one for so long. But at the same time, it's like, it's honestly true that there are a lot of people that go into the hospital and unnecessarily die. So do the research to see if they have checklists if you go under the knife. So then how do docs order services? Like from, specialists, how do they communicate with the labs, x-rays? Well, today it's, paper orders, literally often faxed. Tomorrow, you should be able to share components. Doctors should be able to share components of your profile, just like sharing a YouTube video, various aspects as a physician of your profile, and send them to the lab or the radiologist and ask the radiologist a question saying like, hey, this is this person's chart and history. What do you think about, this belly CAT scan? So then how do these services talk back with doctors? Well, today it's paper orders often, or paper, results often faxed. And if it were designed, the results would be added to your profile by the lab or the radiologist, much like someone sharing a link on your Facebook profile, and just sort of commenting on it, And then, like, how do these services talk to me? Well, your doctor today your doctor receives the results. You make an appointment again because, the doctor can get paid again to see you. And you go in and they say your results are normal, 3 weeks later, right? Well, if it were designed, you would basically be alerted that there are new results in your profile. At the same time, your doctor is also notified as well, because doctors, there's plenty of evidence to show that doctors actually miss certain very important labs because they get 40 of these labs back a day. Meanwhile, you're sort of waiting on these results, so it's in your best interest to get these labs and make sure nothing gets slipped, right? So your doctor could write a personal message to you if your lab results come back, and you can be alerted that there are new comments in your profile. You can comment on the results and ask questions, but most importantly, the deal is, how do we implement this change, right? Because this is a marked difference between what exists today in healthcare. So who puts all this information together and to create an actionable, realistic plan for your life? Today it's your doctor. You leave and you're on your own. Now it's up to you. How do you change your life for the better? When your doctor says eat better, you're sort of like, oh, I should eat better. What does that mean? I should exercise more. I should reduce my stress. It doesn't really work, right? You spend about an hour a year with the healthcare profession, and about like 8,764 without those people. So it's sort of up to you, right? So I'm actually calling for a new kind of profession, and I'd like to call it sort of the health coach. And he or she is a lovely person that specializes in synthesizing your medical information and helping you apply it to your environment, your life. And they're basically, experts in behavioral change science. So, what does that mean? How can we nudge you? How can we get you to switch dinner plates to a smaller plate, if you need to eat less? But basically, they're neighborhood-based, and they're connected to you online. And they just create these micro-solutions tailored for your life. They pretty much get to know you. They're sort of like your health buddy. They're like your go-to person. They're right down the street from you. You can pop in and chat with them. And definitely they're online and connected to you. They ping you on a regular basis to see what's going on, share some new helpful tips, share links with you that are relevant to you. And they encourage you, and they're also triage experts. So they're your go-to person for all things related to health. They answer these questions, right? They're notified whenever you go to the web app that tells you what to do and when to do it. And they know when you need a doctor for medical problems and when you don't. Sometimes you just need reassurance or guidance. So I guess the issue is, how can we get to this really magical place I'm dreaming? To me, it starts with us. It starts with demanding something better of the healthcare system. And when you think about it, we're pretty much all in the same sort of generation today here at this place. Since we were kids, what's really changed in healthcare? Not much. It's the same paper. It's the same charts. It's the same sort of system. The only difference is it's just gotten about 10 times more expensive. And that's what's scary, because in 2020, the average premium every year is going to be about $30,000. And so we've pretty much become pretty tolerant of this, unsafe, disorganized, twice as expensive as it should be, thing called sick care in America. So we sort of feel like it's out of our control, But unfortunately, you're sort of codependent, right? You can't go without health insurance, right? And you're sort of in this bad sort of relationship. But your options are pretty abysmal. You can switch from Anthem to Oxford and back to Anthem, and it's all the same crap. But every time you pay this monthly bill to your insurance company, you're sort of prolonging this bad relationship. We have to know that healthcare is not going to change itself, no matter how much health insurance reform happens. These processes of a great experience isn't going to change, because the deal is, you're sort of not the customer of healthcare. The insurance company is. That's who pays the bills to the doctor, right? So the only way it's really going to change is if we sort of, rise up, basically, and demand and force it to change with our wallets. And I'd like to think of healthcare as sort of like the same sort of sustainability of concept of the green movement. We pretty much need to change our individual behaviors for the collective good, and healthcare in America must be sustainable, right? Because, you know, we're going to have the have and have-nots very, very soon, and we don't really want that. So we just need to sort of, you know, treat this as a movement, and I'd like to treat health design as sort of a new movement within the design community. So we're more about building a community of both designers and doctors, you know, and developers who basically passionately care about creating something profoundly better than what currently exists. So we're trying to build this great experience for you, and so I'm just sort of asking you guys to join us, and thank you very much. So, we've got questions, question and answer. Yeah. Well, we just started about 4 months ago, 5 months ago. So this is actually a big month. We've sort of, you know, everybody knows how long it takes for this sort of, you know, you start the conversation and then all of a sudden, you know, 9 months later, the checks come. So it's pretty interesting. So we're just starting right now, and we have probably, I think we have 3 that I'm like uber excited about, 3 projects that are like significant and awesome. So just follow us for now, and please, in the next month, there'll be some really exciting news about what we're doing that will impact designers' lives in New York City, like, very soon. So it's super, super cool stuff. So I know, it's a big tease. I can't, not yet, no. Yeah. So, yes. Yeah, so the question was, how do doctors sort of respond to these ideas? You know, I think healthcare has a problem in that it doesn't know who its customers are, you know? Because, like, you walk into a doctor's office and there's like a cross-section of the world right there, you know? There's like sick people, there's well people, there's 20-year-olds on their iPhones, and 80-year-olds reading good housekeeping, and even if they can't read, right? So, like, you know, there are 2 sort of customers in healthcare for what we're doing. There's doctors, and then there's patients, right? So I look at the doctors who just immediately write this off as just, well, you're not really our customer, you know? What's interesting is, like, you know, if you asked Apple to, like, sort of design a product that meets the needs of everybody, like, they'd fail miserably, you know? So you have to sort of, like, start by choosing your customer of both patients and doctors. And that's where it gets exciting. So yeah, I mean, there's been a ton of criticism from the boomers, but you know, but then at the same time, some boomers are like, hell yeah, this is awesome, let's go. Something needs to change, you know. So really, I'm just sort of looking at all doctors as just like I look at all people. I mean, there's some people that get it and some people don't. And you know, honestly, this isn't. What's interesting about this is, like, the way healthcare is spent in America, there's only about 10% of us spend 80% of the $2.5 trillion, and therefore 90% of us are light spenders, right? So this actually applies to essentially 90% of America, right? But the deal is, we're all the low-hanging fruit, you know? And so this doesn't solve the real problem of healthcare, which is, like, how do you best sort of manage the health of 10% of people? Because that's where the real costs are coming from. But my theory is, like, if you start managing the health of like 90% of people and solve simple problems first, a lot of these processes will be, you know, ported over into, you know, the really costly section of, you know, people in America. So that was long-winded. Sorry. Yes. A health reform bill? So yeah, what's my opinion of the health reform bill? What's good and what's bad? Well, on page 1872, no, I'm just, you can't call it health reform. You have to call it health insurance reform first. The deal is, you know, it's not how you pay for healthcare, it's what you're paying for. Right now, doctors get paid and profit off your sickness, right? So where's the incentive for them to keep you well? I mean, the incentive is to bring you back 3 times to tell you your labs are normal because, they get $50 each time from the insurance company. I mean, that's what we're paying for. That's the difference between us and like Norway, right? Norway has a closed loop system. They have doctors and patients and payers, and they're all one part of the system. Well, what's interesting is Norway has about 4.5 million people, right? Kaiser in California has 10 million people, So they're essentially twice the size of Norway, just, one insurance company in California. And they're still struggling with the same problem because, healthcare in America is paid for in piecemeal for sickness. So I think that getting more people into the insurance pool for a very quickly skyrocketing out of control cost problem is not a viable solution. And that's what sort of pains me because it's like, what we really need is sustainability rather than mandating in literally 10 years that each one of you has a $30,000 policy. How many people can afford that? So the real issue is I don't think that the government's going to solve this problem because they have to satisfy, the hospitals, the doctors, the pharmaceutical industry, and those are the people that wrote the insurance reform, I think. So I'm a little jaded, though. I'm a doctor. Yeah. That's a good question. I mean, I'm sorry. How do we demand sort of change from doctors today? That's a really good question because, it's sort of like, the doctor experience is very sort of similar no matter where you go because the processes of payment is very similar. One doctor in one office gets paid the same to see you as another doctor in another office from the insurance company. It's the process problem too, and no doctors are really solving that problem. However, I think the one thing that we can do is look into we have to look at health insurance as something completely different than health access, So in a sense, whenever you pay for a higher sort of premium, just like a regular traditional insurance that costs like $450 a month, and you have a $20 copay. Well, every time you do that, you're sort of relinquishing customer status, So I think a lot of times, like if you add up the numbers between a traditional plan and a high deductible plan, because the vast majority of us don't use a $5,000 deductible plan, but every 15 years, I think the best solution is to actually pull as much money out as you can from the insurance industry and then pay for it as you go. And whenever you pay cash, you get a whole different experience. And because most of us don't need that much health care, you can sort of demand a different experience. So again, this is like, it's weird though, because, as a physician, you sort of want to like help and treat the people in society that need it most. And there's this moral dilemma that you have to sort of, do things right and do things like the Apple Store, The Apple Store doesn't cater to the Medicaid population, right? So I don't know. There's not a great solution. My solution is just like, I just want to focus on designing awesome stuff. And whenever I'm successful at that, we're successful at that, I think that pushes the industry. And I think that you can use people who can afford things to say, here's a better process, here's a better way to do things, and hopefully it'll be ported over. Yeah. Yes. Yeah, there's this one. There's a pretty interesting company out there called Minute Clinic, and they're basically like just just mini embedded clinics in like Walgreens. Um, and there's about like I think like 700 or so across America now. And what they did in spreading was they built like the first 200 with like totally separate from the insurance industry and said, hey, look at this. We're managing people for like, $59 a visit. That's awesome, right? Now we have 200 of these. Let's go. We have some leverage. Then we can go to the insurance companies and say, let's make a deal. So that's where I think the insurance and Medicaid and Medicare comes in. But in the beginning, you got to start with cash because that's the way to innovate. Like the deal is our hands are tied in innovation whenever you're dependent upon the current business model of healthcare, the $20 copay and things like that. You just can't do it because doctors have about 4.5 people working for each one of them just to sustain the billing, because they have to take like 20 different insurance companies and all these processes. It's a pain in the butt. So like if we could just remove all of that, the traditional doctor's office is about 70%. I mean, my practice, it was just house call. It wasn't scalable or anything, but it was like 10% because I had no office. I didn't have staff, and we can design a process. We built a couple Hello Health practices, and it looks like their overheads, 25%, 30%. So you can explore a lot within cash. Yeah. So, any other questions? Oh, yes, sorry. 2. Yeah. Yeah. Yeah, preventive medicine and malpractice. Yeah, how do they sort of play into this little scenario I'm talking about? I think prevention is it's interesting because right now there aren't any affinity groups that you have that last that benefit from your actions today to 40, 50 years from now, whenever that stuff takes effect, right? So it can't be your employer because, the millennials change and designers probably change jobs every 2 or 3 years. And, a lot of times designers are independent people, freelancers. And it can't be the insurance companies because when you change jobs, you change insurance companies, right? So nobody really has that sort of, sustained benefit. So I think that only you do. And so, I'm a big fan of just like, instead of group purchasing, I think everybody needs to purchase individual policies. Because, you have an affinity for your own sort of benefits, right? So I think that prevention also plays into this in that prevention oftentimes is accessibility, Like, for example, if you sort of, a lot of people, because they know it's so expensive to go to the doctor, they wait on something. That belly pain could be a lingering appendicitis. And all of a sudden, like, you could have handled it with some antibiotics rather than a surgery, So I think a lot of it is access, increasing access in prevention. So it's sort of, I'm sort of hedging because there's not a lot of evidence to say that prevention saves money for healthcare. For example, like, smokers actually save money for, in the total system because they die early. Seriously. We don't have 15 years of old people to take care of, they die early and it's done. So, it's really weird. So, like, prevention at the system level doesn't really work. It does work at the individual level because it makes you happier, and I think that's what we should be more focused on. Malpractice, really quickly. When doctors have a real relationship with people, they rarely get sued. And when doctors say, I'm sorry, I did my best and I screwed up, they rarely get sued. And there's plenty of evidence coming out to show that right now. And I think one of the malpractice problems is because, like, we don't have relationships with the healthcare system anymore. It's become like a cattle industry sort of thing. And I'd like to see more relationships in healthcare.
Thank you so much, Jay. This was great.